in the first few days, we asked the loved one, the named loved one, to write a letter to the client to describe their concerns or the impact of the client's behaviour in active addiction on them. And that's a really good way of allowing them to start to express some of the things that perhaps they found difficult to express in the time before the clients joined us in recovery. It's not mandatory, but we strongly encourage our clients to allow us to invite a loved one to the latter parts of their therapy, so from usually in a 28-day stay from weeks 3 onwards, because 90% of the time there are issues around trust and communication and many other issues that have arisen in the time prior to the person joining us. And I think it's just incredibly important to start the conversations about those things before the person returns home. Because there are 2 themes that come up almost every time that we do these joint appointments for family members, usually online because we're sort of a destination rehab. One is that the person usually who's coming to the end of their treatment is starting to feel clearer and more confident about wanting to look forward and sort of rebuild and move towards the future. And very often the loved ones who are not in treatment are still left with anger and resentment and guilt that needs to be addressed before they can commit to sort of rebuilding and reconnecting. So what sometimes happens if you don't have these conversations as part of treatment is that there's a mismatch in where the 2 people are. One's really keen to start looking forward and rebuilding, and someone else actually needs to make peace with the past before they're able to do that. That's one thing that comes up a lot. The second theme is very often that the loved ones, Dr. Rees was talking a lot about pro-dependence and trying to support in the best way that you can your loved one. When people leave treatment, often family members and loved ones are so anxious about the possibility of relapse that they'll do everything that they can to try to protect them. And that can feel really controlling or distrusting for the person that's leaving. So it's so incredibly common that the family system will, let's say the partner, I want to know where you are, I don't want you to go here, I don't want you to be with those people. And then the client will feel, I've just done all this really hard work and you still don't trust me. And so that can create tension as well as it's addressed.